Live, local. This is Fox 12 Now.
Hello, everyone. Welcome to Fox 12 Now. I'm Greg Nibbler. Thank you very much for joining us. We're live streaming here out of the Fox 12 Oregon newsroom, so that's what you see behind me. And we do these segments here every single day from 1 p.m. to 4 p.m. Sometimes it's deeper dives on things you see on other news shows. Sometimes we're talking about new information that comes out, and that's what we're doing right now. This is from the Oregon Health Authority, and this is basically some information about public preparedness, and it has to do with poor air quality and how that can equate to more emergency room visits. We're going to get much more in depth with this with the experts here joining us. So we've got Jen Seamans right now from OHA, who's joining us here to talk about this. And Jen, thank you very much for being here with us, really to go into this, into the details here of this. To start off, would you? Yeah, I really appreciate it. And to start off for everybody, would you mind just letting us know, your role there at OHA, and then how this came about, where this information came from?
Absolutely. Thank you so much for having me. My name is Jennifer Seamans, and I serve as the Environmental Public Health Data and Epidemiology Manager in the Public Health Division at Oregon Health Authority. And the tool that we've just released is a dashboard that for the first time is providing near real-time updates on how poor air quality is connected to emergency department and urgent care visits for respiratory illness.
And so, yeah, I mean, being able to correlate that and see that in real time is going to be a pretty valuable tool, to know what's going on. And I guess to get into it just a little bit, can you tell us, about the correlation that this data and this tool is showing for these two things?
Yeah, so the first thing that I'll say is that it's actually not a study. This is really a tool that's for community preparedness and public health response, and we're not looking at statistical correlation here. What we're looking at is how the increases and decreases in air quality are related to who's seeking care at emergency departments and hospitals, and what we can do as communities to understand who's affected and where we can direct our public health resources. Thanks.
So going into that part of it, can you tell us, what that is showing us, I guess, as far as where this is being affected most?
Yeah, the emergency department and urgent care visits are affected by a number of things. Like, in addition to air quality, there's different access in different geographic regions to facilities and care, and so. Sometimes we see a very quick and sustained increase in visits after an air quality event, and sometimes it can be a briefer response, and then things kind of go back to normal. And so our goal is to really understand these patterns of who seeks care when, and how to anticipate that for future poor air quality events.
And when we're talking about air quality events, poor air quality events, are there any specific things? I mean, wildfire, I would imagine, would be one of those kinds of things. What are some other events that would qualify as a poor air quality event?
Yeah, wildfire smoke is definitely the air quality trigger of most concern, but we can also see poor air quality at times during the winter. We see inversion events where things like heating homes with wood and that kind of smoke can also adversely affect air quality as well.
And all of those things can in some way lead to more emergency room visits, or at least that's what you're seeing there with that. So, having access to this kind of data, how does this help, I guess, you from your standpoint of going forward to help maybe plan or mitigate for some of these different issues that are occurring?
It's a great question. And one of the things that Oregon Health Authority has done previously is made air filtration units available to people who are enrolled in our Medicaid program, Oregon Health Plan. Right now, that program is limited to a smaller subset of people, but it's something that we are always looking at possibly being able to offer in the future. And certainly those most in need, so people who have other chronic health conditions, young people, one of the things that we're looking at is air quality in schools, and so looking at where we can most effectively direct our limited public health resources is really important, and this data will help us do that.
That's great. So it'll give you an understanding of here's what we have to work with, here's where we can be the most effective, essentially, in helping to, work on some of these different things that are occurring.
Yeah.
For the general public, what do you think is the most important thing for them to know about this tool?
I think it's always important to anticipate what you can do at home during a poor air quality event, such as during a wildfire. Also, increasingly, wildfire events occur at the same time that we have other environmental exposures, such as extreme heat. And so thinking about how to upgrade your home so that you do have better indoor air quality when the air quality outside is worse is really important, especially if you do have a medical condition such as heart or lung disease that could be exacerbated by that poor air quality.
So analyzing a little bit of what your own potential risks could be, and then combining that with a better understanding of what's going on in the environment.
Definitely.
All right. Well, anything else? I mean, this is all great information I guess for people out there who may want to learn more and be able to follow along with that. What's the best way for them to get access to that?
So the Oregon Health Authority website has information about this and other climate resilience actions that we are looking to undertake as a state. And we work with, in addition to providing public-facing communication to individual households, we also work with some public health partners that are really important in increasing community resilience to wildfire, smoke, and extreme heat. And so that's another way to get connected in your community.
Like anytime you can combine data from different sources and different organizations or different ways that you're putting that together is always good to get a better understanding of what's going on, especially with things seeming to consistently change here in the Northwest, more wildfires, some more heat events. We've talked about this before here on the show too. So all good information to have. So Jen, thank you very much for joining us. I appreciate your time and talking through this with us.
Thank you so much for having me.
And for everybody watching, again, we are live streaming here. We do this throughout the afternoon. We cover a wide range of topics. And so I thank you for joining us on whatever platform you are on. I recommend the Fox 12 Oregon app. It's a great way to watch us live and then also get notifications when breaking news happens. So between 1 p.m. and 4 p.m., I'll be here with that for you here every weekday. But beyond that, of course, all of our other news shows will bring you that information as soon as they get it. And we thank you for being here. So we're going to take a break for right now. We'll talk to you soon. I'm Greg Nibbler. This is Fox 12 Now.